a man in his 20s has come off his bike at high speed.
Are there any obvious injuries?
I think he might have a head trauma and serious lacerations to the foot. His breathing's becoming heavier.
Listen to me. Is there serious bleeding?
I would say yes.
I'm organising help for you now. Stay on the line.
In Victoria, about a fifth of road fatalities involve a motorbike rider, and veteran intensive care paramedic Cam has attended his fair share over the past 19 years.
The patient's in an altered conscious state at the moment, but they've also advised that he might be intoxicated with drug or alcohol. So these often prove to be a difficult scene. Coming off a motorbike at speed, I'm sure the ads on TV are detailed enough that even at low speed, once you hit the road, you can take off a lot of skin, let alone knock to the head, fractured bones or internal bleeding can leave you with lifelong complications just from even minor spills off motorbikes.
You could hit anything, you could hit parts of the motorbike, you could be hit by something and you're not protected by, four doors and the surrounds like people in a car are.
Wow, it is a real suburban backstreet, this.
I get out of my car and I can't see a patient anywhere. I can't see a motorbike.
Whereabouts is he?
It doesn't go.
So, is there much room up there?
So it's a bit confusing initially.
Whose house is this?
My own.
Oh, is this a relative of yours, sir?
Oh, no.
Okay, so, this is what's happened here.
Yeah.
Can we move this car? Have you taken photos so we're right to move it?
As I walk up the driveway, I start to see there is trauma here.
99, continue all back up on code 1.
Skid marks and cars damaged. There's blood all over the ground and there's carnage and debris from the motorbike, and I can see somebody lying on the ground.
Patient's high speed into a garage, hit multiple cars, just getting to the patient now.
And there's the motorbike punched through the rear roller door of the garage. This guy has had a huge impact. He's got huge potential for life-threatening injuries. And at this stage, I really don't know how well or unwell he is.
So, Nathan, what's your perfect day in ambulance?
Oh, perfect day in ambulance.
What makes a really good day for you?
No one really likes night shifts, to be fair.
So night shift is not the perfect day in ambulance when you're rostered on? No.
Yeah.
It's the first time partnering up for intensive care paramedics Nathan and Jody. Both have been in the job for over a decade, but are only just getting the chance to get to know one another.
What did I know about Nathan before we started? Not a lot, but I found out he's kind, generous, caring family man with a good sense of humour. There's two components to a good day for me.
Yeah.
And that is, number one, when we start work in the morning, if I get my coffee.
Yes.
And the second thing is seeing a patient during the day that we've actually had a good impact upon.
Yeah.
I think when a patient thanks you, I feel like you've done your job. One of my favourite jobs was a cardiac arrest that we were able to bring back that we didn't think would. And a couple of days later, I visited him in hospital and he sprung out of bed and he shook my hand, and we got a letter from the family a bit later, saying thank you for one more Christmas with Dad. And those kinds of moments, that's what people do this job for.
Yeah.
That really resonates with me.
Yeah.
The next cry for help concerns a man who has just collapsed in the heat, trying to finish a triathlon.
We're going to a male with primary problem being heat exhaustion. Says that he's not completely alert. A triathlon, that would do the job absolutely, particularly at the tail end of a run.
Yeah, that makes sense.
I don't know how people do that.
I don't think we pay enough respect to what heat can do to the body. If heat exhaustion's left untreated, it can cause hypothermia. Once your body reaches a certain temperature, it can no longer cope. It essentially cooks the body from the inside.
Just looking for a first aid tent or something of the sort. Just as a gentleman just here, he's trying to wave us down without waving.
The body likes to sit in a nice range. Outside of that range, it doesn't cope very well. It can result in cardiac problems, cerebral or brain problems resulting in seizures, coma. You can also have kidney failure. You lose blood pressure. It can go into cardiac arrest. lots of issues that can occur from heat.
Hi, I'm Jodie. Joel, is it? What exactly happened today?
I remember that.
Yeah, okay. When I laid eyes on Joel, he was extremely pale and sweating and extremely confused. These are all signs of heat stroke. He's actually very unwell.
I'm a mess.
You conscious, mate?
In Melbourne's southeast, veteran MICA paramedic Cam is confronted with a horrific motorbike accident.
Open your eyes and look at me. Where's it hurt? What hurts the most? What happened, mate?
I have no idea. I heard the bang and I came running out.
Is that bleeding somewhere?
Yeah, it's very bad.
Yeah, okay. Where's it bleeding?
On his feet.
From under.
Okay, just getting your shirt off, mate, so I can have a look at you, okay?
This guy, he's still got his helmet on. I can see that he's extremely sweaty. He's agitated and restless. He's not really responding. And this can be a sign that their body is compensating for a critical illness. So whether it be a breathing problem or low blood pressure or just severe pain.
Just watch yourself as that car moves, okay?
The owner of the property is still in shock that the stranger made it through his 2 parked cars alive.
I was just doing my gardening and boom, just like that. I thought my daughter, she was just screaming because she never seen something like this, somebody injured or like in our garage.
Hi, mate. You can see there was another car here. He's bounced off a heap of cars, so maybe set up some intramuscular ketamine.
Well, how many oxygen?
Yeah.
At this stage, I am so thankful that my backup has arrived because I've got to try and establish a set of baseline vital signs, control any hemorrhage, protect the airway, manage spinal immobilisation, listen to his breathing to ensure he hasn't got decreased air entry sounds or a pneumothorax or blood on the lungs, fractured ribs, all these things. I can't do all of that on my own.
So everybody on hemorrhage control at the moment. If you find a bleed, control the bleed. Somebody's double-checked the ketamine?
Yes, mate.
Thank you. Bit of a sting, mate.
Ready? Good job, mate.
Sharp out and away. You lie down, lie down.
All good.
Just checking your blood pressure, mate. Try and keep that arm still.
This guy is critically unwell. He didn't have the ability to protect his body. The motorbike skidded along the ground, run into a concrete pole.
That's 86%. Poor trace.
And I have no idea how fast he was going, but from the damage it's seen, it was quick.
I've got his head. Okay. What we're going to do is start moving to hospital, prepare for RSI, manage any wounds, and then probably RSI him en route, right?
There's a concept of the golden hour, which would be get a major trauma patient to a major trauma centre within an hour of the accident happening.
Everyone brace.
Yep.
Ready, set, go.
Because if he did have severe bleeding internally, the sooner I get there, the sooner he gets to an operating theatre.
Just a couple of straps on to hold his hands in.
My biggest concern here is a traumatic brain injury or head injury.
How long were you exerting yourself for, Joel? Can't think, that's okay.
Jodie and Nathan are with 48-year-old Joel, who's suffering heat stroke.
Okay, have you got pain anywhere at the moment?
No, I just can't think.
You just can't think, your head's a bit foggy, is it? Yeah, okay. Have you vomited at all, Joel? Yeah.
Initial heart rate was 145.
Yep.
It was febrile at 39.3.
Yeah.
Rest rate was up there above 40.
Yeah.
First aiders have put Joel on a saline drip and applied ice packs to start cooling him down.
Control!
Friends watching him compete filmed his 3.5-hour effort, showing him on the verge of collapse as he heads to the finish line.
When you got to the finish line, you were obviously feeling pretty cruel.
Blacked out.
Okay, so you can't remember much of what went on?
I remember looking at the finishing line. I don't remember finishing.
Joel is hypothermic, which means his temperature is above 38 degrees, which is of grave concern. He's showing signs that his body's not coping. He's been vomiting, he's had alterations in his mobility, in his brain function, and his heart function as well. have all been affected by the heat.
You know what year it is at the moment? It's a 12 lead as well.
I'm a mess.
Yeah, no, that's okay. That's understandable. Can you take a guess as to what year it is at the moment?
I can't believe I can't tell you.
When a patient ends up so hypothermic, their body's no longer coping. Essentially, your body's mechanisms to cool yourself down stops. And that's extremely dangerous. Joel's obviously put his body under an extreme amount of stress. And what's causing his acute confusion is the fact that he had become so hot, his body was no longer able to cope. I'm just going to rest my hand just on your chest there for a moment. You're still sweaty, aren't you? Hey?
He's got a couple of ectopics in there.
An ectopic beat is an extra beat within the heart. When we see those beats that shouldn't be there, it increases our suspicion that the heart function may not be 100%.
It's amazing what the human mind can push the body to do when it's not enjoying it, hey?
The sooner they can get Joel's temperature down, the better.
We're just going to take your temperature, mate.
Tachy at 134, SATs are 92, Entitles are 43, SpO2's 90% on room air. Blood pressure's 94 on 80.
In Melbourne's southeast, Cam's seriously worried his patient may have internal injuries and brain trauma after he lost control of his motorbike and smashed into a stranger's garage.
Was there posterior chest injuries, do you think?
Not that I could see.
He's very pale. Entitles are dropped. SATs are dropped. We might need to assist his vents. Yeah.
Once we're in the truck, we're managing the patient. We're giving him some fluid to prop up a low blood pressure and an increased heart rate, which are both signs of potential bleeding internally. There's nothing I can do about that pre-hospital. This guy needs surgery and he needs it quickly.
Mate, it's an airway obstruction, Sam. I'll get you to pull his jaw forward, please. SATs a 71 with a reasonable pleth.
He also needs us to maintain his airway and ensure he gets adequate oxygenation.
Entitles of 50 on the naso. Yep. 98 SpO2. So I'm happy that it was just jaw support required.
Sure.
When I look at this guy, he's pretty banged up. He's altered conscious state, he's got a head injury, potential pelvic fracture, his whole back is grazed. I mean, he has worn away all of the skin. He's got burns on him from the motorbike. He's got a huge, deep laceration to his foot and a severely fractured ankle, let alone any other injuries that I can't see internally.
Are you guys happy to start rolling slowly?
Yeah. So Jess, we're just going to start looking for somewhere appropriate to pull over.
I think there's a BP just up here.
Perfect. Yep.
Cam now urgently needs to take over the patient's breathing. As the ambulance moves towards hospital, he preps the medications for the procedure.
This patient needs a rapid sequence intubation because I've got probably 45 to 50 minutes worth of drive time that in any of that time that patient could regurgitate gastric contents and that could flow over into his lungs and cause either catastrophic loss of airway control, decreased oxygen and possibly death.
So just nice and still for another 10 seconds for us.
Back in the city, Joel's temperature is still dangerously high.
Did you guys put his feet up when he was initially brought in?
I tried to lie him down, but he refused.
Yeah.
I don't remember refusing.
We'll just repeat a temperature.
The 48-year-old is suffering from heat stroke after dramatically collapsing over the finish line of his first triathlon.
Have you got a headache at the moment, Joel? No. Joel blacked out. He can't remember the end of the race at all. Heat stroke gets to the point where your body's no longer able to protect itself. His brain wasn't coping with the fact that his temperature was more than what a normal fever would be. Bit much for you, hey?
Finally,
36.4.
Okay, yep, no worries.
Joel's temperature drops and he opens his eyes.
I'm pretty happy just to get a bed. We'll lie him down. I'm happy for him to load with our ALS colleagues for a local hospital.
Joel's still not quite 100%. He's still a bit confused.
Now, I'll grab him if you pull that chair out.
So we're concerned that There could be something else underlying going on that's been precipitated by the heat. So we just need to make sure that we monitor him closely on the way to hospital.
Did you train for it?
Well, I did. Obviously not enough.
It happens to the best of them, my friend.
Joel's friend Schneer was by his side when he collapsed.
I saw you coming down the straight and I was like, oh, he's in a bad way. He was going like all over the place.
You've got to be embarrassing.
Nah, you're right. You're right? Okay. That's all right. Don't be angry. You did really well. It's a really hot day as well. Like, granted, we were sweating this morning just checking the car, so I don't know how you've done a 3.5-hour effort out in the sun out there. Joel did do a brilliant job. I don't know how someone that has been so unwell when he's finished actually got to the finish line. The other ambulance crew is just pulling in now.
A second paramedic crew has arrived to take Joel to hospital just as his memory returns.
What's your home address?
2022.
2022? What's that? The year. Oh, the year. You got there in the end. That's good. That's good. That means you're feeling better, hey? A bit more yourself. Seeing Joel get better and be able to crack a joke about what's gone on was actually really nice. But in saying that, after an episode of heat stroke, it's extremely important that a patient does attend hospital to ensure that their heart's okay, that their electrolytes are okay, because when you've become so extremely dehydrated, your electrolytes will be quite deranged. You been in an ambulance before, Joel? No. First time for everything, hey? Yeah. You've done well. I hope Joel does attempt another triathlon. However, I hope next time he does look after himself a little bit better during the race. It would be nice for Joel to remember crossing the finish line. See you later. Bye, Joel. Would you ever do an Olympic length triathlon, Nathan?
Ooh, that's a hard no for me. I appreciate how people can push their bodies to the limit.
Yeah. I've dabbled in open water swimming and running in the past.
Yeah.
I can't imagine running that far.
Well, I don't look good in Lycra, so I can't see myself on a bike.
No.
Yeah.
Thanks, Nathan. I'm glad you don't own any. It's good. It's reassuring to know.
Yeah.
150 kilometres away in country Victoria, an air ambulance crew is heading out from the Bendigo airfield. The call for help this time is coming in from a son worried about his dad.
It's my father. We're just with him. He's having a heart attack. He used to be a doctor. He's got chest pains and pain down his left arm.
Let's get him some help then.
All set in the back, bud. They got briefing.
Roger.
Air for departure 17, mate.
M3 airborne out of Bendigo.
The heart attack patient is in Toowoomba, more than a 3-hour drive from a cardiac hospital. So it's vital flight paramedic Steve gets there fast, or the patient could die.
So we've been requested by a crew for a 75-year-old gentleman that's having a STEMI or a heart attack. So they're in the process of thrombolysing him or giving him a drug to try and break down the clot.
An urgent update is coming through from paramedics already with the heart attack patient.
He's had 40 milligrams to ectoplasm. He's had 4,000 units of heparin, 2 IVs, 10 milligrams of morphine.
The crew on scene have informed us that they've treated with thrombolytic drugs or drugs designed to try and break down the clot, but it only works in a certain percentage of patients. So it's essential that we get to him quickly. He can go from literally talking to us to being unconscious and then deteriorating to cardiac arrest within seconds.
Oh my God, I didn't recognise you. You look incredible.
Thank you.
It's the start of shift for Taney and Marley, who've not worked together for quite a while.
I can't believe how incredible you look.
Oh my gosh, how exciting.
And a lot more has changed than just Taney's hair colour since the pair were last on the road.
You look fantastic.
I feel great.
After years of extreme pain, the 16-year veteran has transformed her life and is now 45 kilos lighter.
So how did you do it?
I really did it thinking I needed to do something for me, put me first for once. And so I ended up going to see a weight loss surgeon and got a great dietitian.
Amazing.
I was at my heaviest, at my most unhappy, and for any mum who's been overweight, who puts their kids first, they'd understand just how hard that would have been for me. had surgery, and from there, have just
Good on
worked
you
really
for
hard.
being brave enough to talk about it now and how you've lost the weight, and brave enough to be motivational for so many other people.
Thanks, Marley. It's really nice. Losing a lot of weight, for me, it's made me a better mum to my kids, more clear-headed, and certainly giving me the energy that I need as a paramedic.
As their day begins, it doesn't take long for the next emergency to come through.
Okay, we're going to a 97-year-old female.
Yes.
She's not eating.
Okay. Not eating is the primary complaint.
Not eating, feeling weak, and chest discomfort.
Okay. The smallest thing can escalate quite quickly in the elderly. They don't have the reserve like we do. Even simple tasks like getting up and going to make herself some food, that could be exhausting.
Just watch this car,
Yeah.
And this person.
Thanks, buddy.
No urgency.
At 97, you know, any symptom's not a good one. A problem that might not be a big problem to me, like a chest infection, can be fatal to that age group.
Yeah, no, clear. Yeah, you're clear. Yep.
M3 tracking towards Wangaratta.
The air ambulance is just minutes away from touchdown at Wangaratta Airport. But it may be minutes Steve's 75-year-old heart attack patient doesn't have.
This is a very, very serious case. The patient can go into cardiac arrest at any stage, even after he's had the thrombolytic drug or the clot-busting drug, in which case we'll be performing resuscitation inside the helicopter. Landing gear, down through greens, as well.
Worryingly, the life-saving drugs given by a road crew are not working.
Hi, mate, I'm Steve, buddy.
Hey, Steve. This is Ian.
Mm-hmm.
Ian actually is a very busy doctor.
So how long have you practiced medicine for, mate?
45 years.
45 years.
But I retired about 10 years ago.
Okay,
But
beautiful.
he's 75, would you believe? I thought
He doesn't look 75. You look very, very young-looking fella here.
With Ian's background, he's very aware of just how extreme his cardiac event is, and he's also aware of just how dynamic he must be.
7:30, non-provoked chest pain after a shower this morning. He was a little bit grey, a little bit diaphoretic. Blood pressure was in the 180s. He was in a ST elevation rhythm.
Having a look at the ECG, it suggests that Ian's presenting with a large blockage in his right coronary artery. However, further investigation indicates that there may be also some posterior involvement or the back part of his heart. So there's a higher risk of even going into cardiac arrest.
Gave him 8,000 units because he's 75. 4,000 of heparin.
He's also had 30 milligrams of morphine on top of that.
And also aspirin, I take it? Yep.
Aspirin.
300, yep.
And on Vans as well.
Beautiful.
So we've achieved some improvement.
Ongoing.
The thrombolytic drugs designed to try and break down the clot hasn't actually worked yet. So he's still showing signs on his ECG that he's having quite an extensive heart attack.
What I might do, just because it's a long flight and he's still got that ongoing, I might just get 3 milligrams of adrenaline in a 3 ml syringe.
3
just drawn
milligrams
up.
of adrenaline.
Yeah, just neat. I'll get a bag of fluid, just in case.
As a profession in paramedicine, we anticipate the worst and we prepare ourselves as best as we can. But it's really important that I just try and remain calm and keep Ian's mind at ease. Internally, though, I'm concerned. I'm extremely concerned about Ian, and I'm worried that at any stage he can deteriorate rapidly.
And right now, what's the pain?
There's just a little residual pain.
Show me whereabouts, mate, if you wouldn't mind.
Here.
I'll treat your pain. I'm probably going to switch you over to fentanyl or something like that. I'm happy to come on out if you want to jump out and we'll just watch that bag of fluid.
A STEMI is probably the most serious form of heart attack you can have, and it's extremely time critical because the longer the patient's presenting with a STEMI, there is without doubt cell death taking place in his heart.
Get you over and get this blockage taken out of your heart.
We can't do much more other than get him to hospital as quick as possible.
Are you ready?
Yes, ready.
Okay.
A motorcyclist's life is at stake after he crashed into a garage at high speed. The man's injuries are so severe, Cam needs to take over his breathing so his unconscious patient doesn't suffocate.
So he's getting 15 mils. Any reason that we shouldn't do this? Anyone?
No, mate, I'm happy.
And just administering rock. No contrast to the rock?
No, mate.
No? Okay. When he becomes apneic, I want you to assist ventilations for Sam.
Just very gently.
Yeah, really, really gently.
What we're going to do is paralyse this patient and take away his ability to breathe.
Sam, I'm happy for you to have a look.
Yep. Okay. It was taken off by the side. That on the chest, please. And you're right to be in the airway system, mate. Kyle, I'll just get you to just take a step back for me, please.
The RSI procedure itself is something that has potential to go horribly wrong.
So I have a grade 1 view of his vocal cords, mate.
He's going to be 100% reliant on us getting that breathing tube in the right hole and then ventilating him to keep him alive.
Keep the view sighted that.
Yeah, that's going through, mate.
That there for a tick.
Just remember you guys, it's just caught up on the top. Yep,
I've got that.
Thanks, mate.
That's still 99%.
Thanks. Watch it.
Yep, that's gone through.
International markings.
Yep, I'm on it. Yep.
Okay. Bougie out. Watch your eyes.
Thank you.
Cam and Sam have managed to get the tube in, but if it's not in the exact right place, the patient won't be able to breathe.
Half inflated.
Thanks, Cam.
Seeing rise and fall.
Yep, I'm seeing misting of the tube, and I have good end titles on the monitor, and I have end titles on the EMO-Cam.
The procedure is a success. The ventilator will now breathe for the man whilst the team rush him to hospital.
We're ready to start to roll lightly again. Amazing. He's very lucky to be alive, I think.
With trauma like this, somebody ejected from a motorbike into a solid structure, if not the ground or other cars, you run the risk of so many life-threatening injuries. Traumatic brain injury, skull fractures, bleeding into the airway, spinal cord injury, leading to potential quadriplegic or paraplegic injuries, fractures of long bones, bleeding internally, bleeding of major organs. I mean, this guy, he's one with a lot. He could have any or all of the above, and any of those could kill him.
Yeah, motorbike trauma, mate. I used to ride a motorbike for years on the road, and I'm almost too scared now because I don't want my son riding a motorbike on the road. He's very proficient on a dirt bike, but I think in his mind he thinks, oh yeah, I'm going to get my motorbike licence and off we go.
Yeah.
And every time I come to something like this, I think, nah, not my son.
Yep.
This event will have ongoing consequences for this gentleman, without a doubt.
Okay, happy to start to move slowly.
The grazes and the burns to his body alone were substantial, let alone any other life-threatening injuries that they find at hospital.
Thank you.
Here we go. Perfect, okay.
In Melbourne's southeast, Taney and Marley have arrived to assess a 97-year-old who stopped eating, is feeling weak and has chest pain.
Hello, how are you?
The elderly patient was only released from hospital yesterday, and her daughter is concerned she's going downhill.
Who are we here to see?
Beryl, and this morning she hasn't been well.
Sure. Hello.
Hello.
Hi, Beryl. My name's Marley. I've got Taney here.
Oh, thank you.
Well, what's happening?
I'm not in pain or anything.
Okay.
If I eat, then after a while I throw it up.
Okay.
And she's also got pain here, which was a bit more severe earlier on.
So you just said no pain. So you've got pain in your tummy?
Well, when I press like that, it's discomfort.
Beryl is downplaying her symptoms, but she could be quite sick and not even be aware of it at this point.
What about your chest? Any pain in your chest?
No.
What about your back?
What?
Your back. Any pain in your back?
No, I don't think so.
She has nausea, indigestion and fatigue, and although they're not the typical cardiac symptoms we look for in a heart attack with that crushing chest pain, she may be having a silent heart attack and not even know it.
So you've had a couple of vomits.
Yeah.
Pop this arm up for me.
Oh.
Do you feel like you want to throw up now?
No, I feel all right.
I'm going to stick some stickers on your tummy. Is that okay? Sharp sting.
Typically, when we go to a patient, we look for an ECG change to see if you're having a heart attack.
So 117 on 80, heart rate of 80.
The sugars were 7.6.
So that's pretty good.
But in some cases, we can't see that, and that's something that I'm worried about while I'm assessing Beryl.
Now, our dispatch said that you were 97, but you don't look 97.
I'm 96.
They lied to us. Well, that was a blatant lie, wasn't it? You still look pretty good for 96.
It's nice to see Beryl smiling.
Can you swing your legs towards me?
But the only way for us to know if she's having a silent heart attack isn't on the ECG. It's to take her to hospital for a blood test. We need to get her there fast.
Can you show me where the discomfort is? Can you show me again?
Taney and Marley are looking after elderly mother of 3, Beryl, who's reluctant to admit she's not feeling well.
So it's down further, it's not up here. Is that right?
Yeah.
The stoic 96-year-old is showing all the worrying signs of a silent heart attack, but only a blood test at hospital can tell.
And your pain is still mild, or is it more than mild now?
Oh, yes, the pain's negligible.
Negligible? Meaning?
Well, it's just so mild.
Okay.
Beryl's vital signs are all good. They're all within normal limits. However, we know she's mentioned chest pain. Obviously, we always think heart attacks. If we didn't take her to hospital, there's every chance that Beryl would have deteriorated.
Did you ever work, or were you home with the kiddies?
I did both, actually, when
Really?
I got older.
What did you do for work?
I was a bookkeeper.
A bookkeeper. Ah, did you enjoy it?
It was quite, I liked it, actually.
Excellent. Can you pop your head forward for me? There we go.
Ah, that's better.
That's better.
My husband was not very domesticated.
Right, but you changed that?
No.
You didn't domesticate him?
No one.
What are you doing, Beryl?
Exactly.
Oh, you've got to train them.
He had no idea. When he did retire, he said, "You're on your feet all day." But I said, "This is nothing. Just imagine what it was like with 3 children."
No, that wouldn't fly in my household. My husband does half of everything. We share half of all the chores.
When I got to Marley's house this morning, Tim was vacuuming.
Yeah.
Oh, that's good.
Yep, he's very good.
If my husband didn't help me do work around the house, I tell you what, I wouldn't be like Beryl. I'd be in the market for a new husband.
We're just pulling into the hospital now.
With Beryl at hospital, they are likely to check her bloods to make sure there's no signs of a medical event or other problems going on. They'll monitor her for a period of time, and I hope that she gets well and goes home to her family really soon.
All right, love.
Heart rate's up a little bit, so...
It is a tachycardic at the moment.
It is a little bit tacky, isn't it? It's just picked up the pace.
Back in country Victoria, retired Dr. Ian is acutely aware he's having a massive heart attack.
There's been no resolution, so it's safe to say it's a failed thrombolysis at this point in time, yep.
The clot-busting drug he's been given isn't working, and flight paramedic Steve fears time is running out.
Ian's one of these patients that, despite looking quite well, is extremely unstable. So my concerns are that the management that's been undertaken so far hasn't had any effect. So I'm looking at potentially 45 to 50 minutes in the back of a helicopter with a patient that at any second can go into cardiac arrest.
All good. Right to go.
Ian was away with his family when the crushing chest pain kicked in and his son called for urgent help.
I just want to know that at the moment the pain's about 3 out of 10 still, yeah?
It's creeping up a little bit.
Yeah, and still located in the same region?
Yeah, still same, yeah.
What was it this morning?
I'd say about 7.
Okay, so it's quite significant, yeah.
Quite significant. I had a shower and rubbed myself down and started to do a few sit-ups, and then it came on with full pelt and there was no relief with anything.
What I'll do, mate, I'll give you some fentanyl and we'll reassess the pain in a few minutes and we'll keep going at it until we try and get it down to a 0.
It's only a few minutes into the flight, and Steve is becoming increasingly worried about Ian's vital signs.
He's still got significant elevation in those leads. If you have a look from his previous ECGs, mate, it's actually worse. The SC segments have come right up.
Ian's blood pressure really concerns me, that not only is he having a massive STEMI, but he could also have quite a large stroke.
A little bit concerned about that blood pressure. I think I'm going to have to bring it down, mate. That's just too high.
Well, I think Ian is very aware of just how extreme his cardiac event is. And I can only imagine how uncomfortable it must be for a medical professional to be actually looking at his own ECG, and he can quite easily see that he's having a major, significant heart attack.
So what I've done, I've just popped a little GTN patch on you. I'm trying to treat your blood pressure because it's quite high at the moment. Given the medication that we've given you, we're just a little bit worried about some of the complications.
So Steve makes sure he's ready if Ian goes into cardiac arrest and needs resuscitation.
He's got pads on, has he, mate? He's got pads on, mate, yeah. So we got resus drugs just here, mate. I got resus adrenaline if needed.
I'm watching him like a hawk. I'm waiting for any deterioration where we're prepared and we'll instigate our management if needed. However, we're acutely aware that Ian's still critically unwell and requires the procedure to be done as quick as possible.
How are you feeling right now? You still got that pain?
Yeah.
It's still in the middle of the chest,
Yeah, hasn't travelled.
Steve and the air ambulance team are anxiously monitoring patient Ian, who's having a massive heart attack.
Looks like he's got right ventricular and posterior involvement. I'll keep on taking your blood pressure. I'll give you a little bit more fentanyl and we'll try and get this pain down.
Okay.
Ian's presentation of heart attack, coupled with his high blood pressure, makes it quite a delicate act for us. We want to give him a medication, but we don't want to reduce his blood pressure too much where it actually causes further complications. So at the moment, he's really on the knife's edge as to whether or not he will stay in this state or actually go into cardiac arrest.
Ian, we're just a couple of minutes out of landing. It's not too bad now, mate. That's come down a few points. Well, I think that slow delivery is helping, yeah.
With the hospital now in sight, emergency doctors are on standby to rush the 75-year-old into surgery to get his heart unblocked.
Ian's still presenting with a major heart attack. We have been successful in treating his blood pressure and bringing it down somewhat.
All right, well, there's still been no real change on your ECG, regrettably.
So the quicker we get him into the surgical department so we can have the blockage removed, the better it will be. But Ian's fight's far from over.
You're going to the cath lab, mate?
Okay, oh, I really appreciate it.
Oh, pleasure, mate, pleasure.
If I eat, then after a while I throw it up.
Okay.
Beryl's daughter called for help when her elderly mother started experiencing nausea and fatigue.
Sharp sting.
Doctors discovered the stoic 96-year-old had in fact suffered a major heart attack the night before Taney and Marley arrived.
And your pain is still mild, or is it more than mild now?
Oh yes, the pain's negligible.
Beryl went on to spend 3 weeks in hospital and rehab before she and her family made the tough decision to move her into an aged care facility.
Hearing that Beryl had a heart attack the night before we arrived, although it's sad, it's not particularly surprising given that she presented with nausea, fatigue and indigestion. That generation don't particularly complain, and it's something that we have to be mindful of. If we had have left Beryl at home, she probably would have deteriorated, and that's definitely not something that we want for Beryl.
And right now, what's the pain?
There's just a little residual pain, I'd say.
Show me whereabouts, mate, if you wouldn't mind.
Retired Dr. Ian knew exactly what was happening when he felt severe pain down his arm and chest. Once at hospital, Ian was rushed into surgery where doctors placed multiple stents in his heart to clear his blocked arteries and treat his ongoing heart attack.
You're going to the cath lab, mate?
Okay, oh, I really appreciate it.
So everybody on hemorrhage control at the moment. If you find a bleed, control the bleed.
Cam was extremely worried his young patient had catastrophic injuries after losing control of his motorbike. The man did in fact have head, spinal and pelvic injuries, as well as multiple lower body fractures and major damage to his skin. He has a very long road to recovery.
How long were you exerting yourself for, Joel? Can't think, that's okay.
And it's been 2 months since father of 3 Joel collapsed with heat stroke while competing in his first triathlon.
When you got to the finish line, you were obviously feeling pretty cruel. Okay.
When first aiders reached the 48-year-old, he had a dangerously high temperature, an unusual heart rhythm, and no memory of crossing the finish line.
Make a tea? Peppermint?
Sure.
Sure, okay. So I remember the swim leg fondly and then hopped onto the bike. The bike I found a bit challenging and then onto the run, and I really recall the last 5K was a very, very big struggle. But I just kept on telling myself to let's just finish, let's just finish, let's just finish. I remember just thinking, I've got a wife, I've got 3 children. I was quite angry with myself for having driven myself so hard. I called you or you called me?
You called me.
When wife Maxine heard her husband was in trouble, she rushed to the hospital to be by his side.
It was scary. They were concerned about organ failure.
And he seen me hit the rail. I remember hitting the rail going, oh, I'm really wobbly.
He was actually kept there overnight and the whole next day.
Thankfully, Joel was cleared of any serious heart or organ damage and sent home with permission to get back on the training track.
I feel extremely grateful for the paramedics. They make an impact on people's lives, and I certainly don't take that for granted.